Hi everyone, my name is Pengyi Shi. I'm assistant professor from the Supply Chain and Operations Management group at Krannert. So today I'm gonna talk a little bit about my research. My research interest is in using data analytics and decision tools to improve the efficiency in different kind of healthcare facilities such as hospitals and also improve patient outcomes. So let me illustrate what I'm doing with one of my recent research projects. So in this project, we develop a decision support tool to help hospitals to balance to reduce the inpatient readmission rate and the so-called inpatient overcrowding issue. So you may ask, what is that? So let me illustrate. Imagine you have a family member who needs to get a knee replacement surgery in the hospital. So say this family member will get the treatment and was discharged, say 2 weeks ago. However, in today or the coming week, this family member starts to experience a pain in the knees and also shows fever and some other symptoms indicating an infection may start to develop in the just replaced knee. So unfortunately, you and your family has to take this family member again back to the hospital and to check what other things may going on and whether the surgery has to be redone. So this is the so-called readmission in the hospital. Clearly, it is an undesirable and painful experience for both the patients and the patient's family members. And from the hospital perspective, this readmission is also undesirable, especially since 2012, the government agencies start to penalize the hospital if they occur a very high readmission rate. And a lot of the medical research have found that a major reason for a high readmission rate may be because that the patient didn't get a sufficient amount of care or treatment in the previous hospital stay. So, or in other words, the patient was prematurely discharged from the hospital. So in the sense that the hospital needs to make sure the patient receive a good amount of care before they discharge the patient. So now you may ask a second question. If this is the case, why not the hospital keep the patients for as long as they want in the hospital? So there is the key trade-off to balance. So there is a limited amount of a resource available in each hospital. The resource here means the number of available inpatient beds the patient can stay on, the nurse, physicians, and other staffing resources that need to take care of the patients. It will be very unnecessary a waste of all this expensive resource if you keep already kind of healthy patients for staying an extra amount of time. So that's why it is critical for hospitals to balance this delicate trade-off of not discharging the patient too soon enough and also make sure that new patients can get into the hospital and you don't waste your expensive resource for keeping the patients in the hospital too long. That's why, however, while to balance this delicate trade-off, there are several challenges. So first, each patient is different. And it is difficult sometimes for physician and hospital to exactly predict how the patient for example, the readmission or patient outcome will look like after they spend another day or two in the hospital. Second of all, there's this so-called uncertainty in the hospital environment all the time. What does that mean? It means each hospital don't know who may show up next day and how many extra patients may need the resource in your hospital in the next day or even next week. So that is why in this project, we have developed a sophisticated decision support tool to help the hospital address these two challenges. First, we use machine learning and data analytics technique to develop a prediction tool that can tell us how the patient's disease and the readmission risk would progress while they spend longer time in the hospital. second, we integrate this prediction tool into a discharge optimization framework. And from the framework, we can provide discharge recommendations that could depend on the hospital current occupancy, the current amount of patient profile, and expected patient profile and arrival volume in the next few days. We have run a number of numerical and theoretical analysis to show that this integrated tool can indeed help hospitals to improve their operations, including reduce the overcrowding issue and reduce the patient readmission. And in fact, our tool is currently under a pilot implementation at our collaborating hospital, and we also find empirical supporting evidence showing that this tool is indeed helping them to further reduce their readmission risk without incurring extra financial costs on their staffing part. So far, I hope you guys have a understanding of what I'm trying to do, and we expect this in this project, this tool is going to be under a full-scale implementation in this hospital, and hopefully in the future, more hospitals can benefit from what we are doing right here.